Hello, my name is Christina, and in this video, I will show you how GIDEON supports travel health clinicians. Let's start with our countries. GIDEON tracks infectious diseases in 235 countries and territories. Suppose we have someone who is going to Bali and we are about to do a pre-travel consultation for that person. Now, we might not know what Bali is, so we can just type in the name and GIDEON will find us Indonesia, a very popular holiday destination. Now, scrolling down the country note of Indonesia, we can see the official country requirements. In this case, yellow fever is not endemic. There are vaccinations that are recommended for travelers go to Indonesia, and there's data to back that up. So, for example, rabies vaccinations, over 66,000 bites reported in 2023 alone. So this is definitely recommended to get that rabies vaccination. And then perhaps we want to provide with some advice about how to avoid other common infectious diseases in the country. And for that, we have the section, precautions related to other diseases. So avian flu, tuberculosis, Zika, chikungunya, and dengue, they are all present in Indonesia. And perhaps we might want to inform our patient how to avoid catching such an infection. Now, malaria guidelines are quite granular in GIDEON. We do spell out the particular areas that are at risk for malaria transmission, also whether chloroquine resistance has been confirmed in the country, and what are the recommended prophylaxes. Going down, we can see all diseases that are relevant to the country, when the latest outbreak has occurred, and how many cases were reported. And then further down, there's a vaccination coverage graph and the vaccination schedule. And all of this can be downloaded in a PDF or emailed straight to the patient or perhaps a colleague for research purposes. Okay, let's switch to a different country. Perhaps our patient is going to Brazil. And Brazil is a lovely country. However, it is in danger of yellow fever virus transmission. And there will be extra requirements for those people going there. And GIDEON spells that out very, very nicely as well. Vaccine-related requirements, again, non-vaccine-related requirements or suggestions of how to protect yourself. Again, malaria guidelines and risk areas identified. And the prophylaxis. Notice that we cross-linked drugs recommended for prophylaxis, such as doxycycline, where we can find the mechanism of action, typical dosage, any toxic effect warnings, interactions, and so on, and even trade names that this substance might be available as in different countries. Okay, so talking about Brazil, as we scroll down this list, one thing in particular might catch our attention, and that is dengue outbreak. So at the time of recording this video is 2024, and the dengue outbreak is ongoing with well over 1 million cases now. So if I click on dengue in Brazil, what that will do, it will take me to one of the 25,000 country notes that GIDEON maintains for each endemic disease and country pair. And it goes back quite a bit. So for every country, from the very first time that disease was reported in the country, you'll get a nice historical overview, also what the country is doing about tackling this particular disease. So in this case, there's a quadrivalent dengue vaccine approved, any relevant graphs of cases, deaths, geographical notes per province. So perhaps a particular province is of interest or for clinical research purposes. Severe dengue cases and deaths, prevalence surveys, again, great for research. Scrolling down below, seroprevalence surveys. So you can really see the huge amount of data here. And if I sort outbreaks by year, we can see the most recent ones, what's going on, what are the dates, when was it declared, and the case count. And again, we can download this PDF or email it to whomever we might like. So let's go back a bit. Let's suppose we have a patient that is making a multi-country trip, and perhaps they are particularly concerned with dengue. And so let's compare Brazil, Guyana, and Peru. A lovely South American trip. And I'm just going to compare rates per 100,000 here. So let me add Brazil, Guyana, and Peru cases rates per 100,000, generate chart, and find out which country is the riskiest in terms of catching dengue. In this case, we see Brazil is leading the pack, with Peru being second riskiest. Now we can see this in a data table if we like, export it in whichever format we like. Again, this is great for informational purposes. Sometimes travel health clinics provide information leaflets to their patients, and so this kind of tool could be really helpful in contributing to that. And disease outbreak maps likewise could be very helpful. This is a cholera outbreaks map, for instance. And we could show cholera outbreaks just in the past couple of years and where the hotspots are with the endemicity legend. So all I would have to do is set the zoom level to what I like and hit download. And this will give me a very nice graphic that I can then insert into leaflets or presentations and so on. Also, travel health clinicians might be interested in tracking the global outbreaks landscape at any given moment. And this is again updated in real time by GIDEON team. And what we can see here is that there are quite a few outbreaks going on in 2024 already. These are the case numbers, so we can sort by case numbers, we can sort by country, depending on where the patient might be going to, or we can zoom in, zoom out. You can see the bubbles disperse because we are geospatially coding every outbreak and cases. And there's quite a few going on at the moment. So this can really, give you that data at your fingertips. But if you're doing any historical modeling for research purposes, data goes back to 1900s. Okay, well, suppose the unfortunate event happened and a patient contracted an infection and came back to the clinic after their travels to be diagnosed. GIDEON has tools for that. And because GIDEON tracks every infectious disease in every country, it knows how common is each symptom in each infectious disease and how common is each infectious disease in each country. So if I select Puerto Rico, for instance, an adult returning from Puerto Rico, we can see the diseases sorted by probability. And this will be different for every single country, depending on what is most prevalent there. So suppose our patient is complaining of fever, back pain, there is rash visible, jaundice, okay, and so far we're thinking, okay, maybe it could be dengue. But the patient remembers camping in the jungle and encountering rats in close quarters. So I can add a rat contact right here. GIDEON will translate that to rodent contact. And now we have a very different workup here, very different diagnosis probability. So leptospirosis seems to be quite likely. Let me just add that quick to comparison list so we can investigate it further. Endemic typhus, rat bite fever, Q fever, just in case, I'll add all of them to comparison table. But we can see this first case scenario is blinking. Now what's that? This is a feature that GIDEON designed by the request of WHO, that's World Health Organization. And this helps identify diseases that are not endemic to that particular country, but could be the very first case of that disease. Otherwise, it could be a spillover event, an imported disease, or anything of that sort. And in this case, we can see that hantaviruses is actually quite likely. And who knows, maybe somebody brought infected rodents into the country. So let me add another 2 diseases to the comparison table, and I'll show you what we can do with that in a second. Before I leave this interface, I do want to show you that we can query GIDEON why something did not appear on the list. So why is dengue not on the list, even though it seemed so likely after we noticed jaundice? Well, dengue is not associated with rodent contact. And because we think that rodents may have something to do with this particular infection, this disease has been taken out of the equation. Now, we can always remove and recalculate and arrive at a different diagnosis. We can download this case, we can email the PDF, or we can go ahead and compare those diseases side by side. Now, GIDEON is the only tool in the world that allows side-by-side clinical findings comparison of infectious diseases. And here we can see what's usually present, what's always present, what's never present in each of those diseases. And this can really help narrow down how likely is a particular diagnosis that we might be considering. So looking at these clinical hints, these are just very quick clinical hints to sort of help guide the trained mind into what could be more likely, what lab tests may be ordered here. And again, we can download this PDF, we can print this off. This is quite an extensive table, and we can always inspect the exact percentages. But we can also compare those diseases by their fingerprint. In this case, what is meant: agent, reservoir, vector, and vehicle. These could also provide further clues into how this might be. Likewise, we can compare bacteria to bacteria, mycobacteria, yeast and algae, and also anti-infective drugs, should that be of interest. Okay, so let me stop right here and thank you for watching. If you would like to find out more, please reach out to GIDEON team, book a free demo. I'll be delighted to connect with you and delve deeper into what GIDEON can help you with. Thank you.